Yeah.
Yeah,
Hi, good morning. Welcome again, Dr. Bates. It's been a while. The last time we met was October 5th, 2024. I was at your place. Welcome. How are you today?
I'm doing very well, Reverend Moore. Thank you for having me.
Okay. We talk about mental health, if I recall correctly. What is mental health issues that we face?
But first of all, thank you again for this opportunity. I would like to first of all define what mental health is. And when we talk about mental health, we're talking about the social, the emotional, and the psychological well-being of anyone, right? The way we think, the way we act, the way we do things, the way we deal with stress and how we deal with other people. These are all attributes of what, mental health is.
Okay. Okay. Thanks for that definition now. So you have defined mental health. I guess the next one is how do we who are the professionals that handle these things and how do we deal with these problems?
Well, so there are several key factors depending on what the person is dealing with, right?
Mhm.
So you can work with a team of professionals. You can work with a psychiatrist.
Okay.
You can work with a psychologist. You can work with a therapist. These are all people who are involved in this kind of work. Now, if you have a team of people, for example, if someone came to me as a therapist and I did some work, the likelihood is that I might figure out that they might need some work done with a psychiatrist. And because I'm not competent in that area, my responsibility would be to refer that person. That is one thing that is also key. We need to learn how to refer to people who are competent in a specific area so that we're able to provide the holistic care that the person might need.
Explain to me the difference. You said what? Psychiatrist and what's the other one?
Yeah, so we got a psychiatrist, we got a psychologist,
Okay.
and we have a therapist. They all work together, basically. Psychiatrist would be someone probably who would go a little more in depth in terms of providing prescription
Okay.
medication for that person, especially if there is something that is deeper than that psychologist or the therapist can discern. That is where they would go, and that psychiatrist would do an assessment to determine what kind of medication management that particular person needs to be on.
Okay. Good. The last time we talked, you mentioned five things I'm trying to recall correctly. Can you list those five things and refresh my memory?
Yeah, we have mentioned three of those, right? So we talk about the emotional, the social, and the psychological. The two other elements would be the physical and the spiritual. And I alluded to my line of work as a pastor, pastoral counselor. It incorporates the other aspect of counseling. The difference is that mine is spiritual. We deal with the spiritual element that is incorporated into our everyday work. So
Okay.
spiritual and physical will be two dimension that we can add to those three.
Now, because of time constraint, I know you have a hectic schedule. Can you just focus on one? I think you mentioned physical. Can we just deal with physical for today, and next time we can come back and handle other items?
Yeah, so in everything we do, we need to make sure that we are our bodies uh, in good shape, right? For example, if you're not taking exercise, your joints will get stiff. I know that for a fact. I know that for myself, right? When we're not able to move about, we're not able to think very well, right? We're easily tired. So these are all attributes that we need to be mindful of, right?
Okay.
Sometimes when we don't take exercise, there are sleep disturbances, right? These are all physical things, right? There will be a disturbance, right?
Yeah.
There are people who go to sleep and they wake up in the middle of their sleep, right? They're not able to sleep through the night. There are some who get up. There are some who they're just physically tired. They're joint pain and so forth and so on. Sometimes we feel pain in our chest, in other parts of our body, so the aches and pains, lack of energy, these are things that could lead to depression, right? We have lack of energy, we feel tired at times. Time when we're supposed to be energized, we feel very tired. We find it difficult, for example, to even complete a task because we are not, able to do so. We're just so tired. Um, there are other attributes as well. Sometimes you find slow movement in your speech. And so if someone came to therapist and I'm observing all of these things, I know that something is wrong. I can physically see that. And I can also hear some of these things. It will be a reason to think that, okay, this person is going through something more and that we need to include somebody else in the care management of this person. In this case, perhaps a psychiatrist who might prescribe some medication for depression, maybe. Sometimes there are people who will come that have low drive. They're just not energized to do anything. Their concentration level is just so poor. You might say one thing to them, and if you ask them to repeat phrases, they're just lost. They're not able to repeat what you said. And these are things that we look for. That's one of the reasons why it is so good that when you're having these sections, to have people physically present so that you can be observant in what they're doing and so that you can be able to make intelligent decisions with regards to their health.
Well, have you ever done online, like video? We're doing video Zoom conferencing right now. Have you ever done that before? Because we're aware of COVID and all these things that happen. Have you ever done that?
Yeah, so the state of Virginia, where I'm in, I live in Virginia, there are provisions for that. It is better if you can see the client in person, but because of COVID restrictions, there are clients that you can see online. And we do telehealth is what it is called.
But it's extremely important that you do see. So when you do meet a person, what are some of the physical signs you look for?
Sometimes I look to see how they respond. Sometimes I look to see whether they are present. There are times you're speaking with clients and they're looking away. They're looking at the ceiling. They're looking on the ground. They're looking through the window. It is okay to do that like briefly, but if it is sustained, it is signal to me, for example, that person is looking away from their problems, right? Because they're supposed to be present. They're supposed to be focused. Looking away is a very clear indication that this person might be hiding from something or running from something. And so I'm able to quickly bring them back by asking some basic questions, just based on what I have observed.
So what are some of the standard questions you ask, I guess? Since I'm new at this, what are some of the basic questions you mentioned? Basic questions. What are some of the basic simple questions that you ask someone?
There are two things that I do. I observe and I notice I use those statements very, very often. I will say to a client if that client is just looking on the floor or looking to the ceiling or looking outside of the window when they're supposed to be focusing and paying attention in the room. One of the common things I will say that I observe that you're looking away from the room, or I will be very specific. I observe that you're looking on the floor. I observe that you're looking into the ceiling. Um, and I'll just leave it at that.
Okay.
Other times I will add to that, what is happening? I notice that you're looking in the ceiling. What is going on? Share with me. But other times I would just leave it just like that to give them the opportunity to respond to what I have observed. And again, my observation is subjective.
Okay.
I'm just letting them know what I observe, and I'm looking to them now to continue that conversation to help me help them be a better person.
Now I can't continue can't leave us this specific discussion panel because you just discussed it the last time. You also work with the Bates Foundation and you made a trip to Liberia, and I'm positive that you did do some observation when you were in Liberia. Just
Yeah.
if you can recall, what are some of the observations you made when you were there?
Well, some of the observation was that people are just angry.
Okay.
You can ask someone a basic question, and what you might be thinking of as a simple, courteous response, someone may just scream at you.
Okay.
And so they're now fully understanding why someone is responding that way. Does it make it right? No, it doesn't make it right. But people are angry because they have not been given the opportunity to be heard.
Yeah.
People have gone through a lot of challenges, the two wars, 2 decades of war fighting,
Okay.
people just trying to survive. The basic necessities of life are absent. Just a few persons, are enjoying the immunities. And so people are frustrated. Those things come out of frustration. And so I observe that it is very clear. People have not been given the chance to tell their stories, to talk about their hurt and pain, and they're looking for ways to let those things out. And sometimes it come out in not, the way that it come out, it just not so healthy. And then someone may respond to that scream or anger in like manner. And then before you know it, what's supposed to be a civil discourse
Mhm.
turns out into an argument.
Okay, can you recap? I know you're pressed for time. Can you recap a summary what we just discussed on the physical ailments that we should observe so our listeners can appreciate your expertise?
Yeah, thank you again for those who have joined us. We thank you for listening. One of the things I want us to pay close attention to, for example, would be some of the physical manifestation when it comes to what we hope people could do to maintain a healthy work-life balance. All right, we talk about your change in appetite. You need to observe that your change in appetite. Are you eating too much? Are you eating too less? Are you sleeping too long? Are you not sleeping at all? Or are you sleeping, waking up in the night? Those are things to understand. Lack of energy. You need to observe your energy level. What are you doing to ensure that you're taking the kind of exercise? You need to observe the body aches. Your body is telling you something when those things are happening to you. So it's good to be observant and pay attention to them. There's another thing that I wanted to mention. It is very crucial, the movement in your speech.
Okay.
If you find out that your speech becoming slur, or you just becoming slow, knowing fully well this is not who you usually are, that is something that should catch your attention immediately to go to the hospital, go to a doctor. That is not a medical thing. And so sometimes this is why we collaborate with a medical doctor, a psychiatrist, so that what we observe in counseling, we can make that referral so that they can do that. And the same thing, if that client or that person went to a psychiatrist or to their doctor, the medical doctor is not trained to do counseling, so they will refer that patient to us, who happen to be the counselor. And so that is why it's good to have a team of professionals working with us. And sadly, we do not have much of those in Liberia that I just visited. But we're trying to see how we can take baby steps to ensure the kind of care people need are available. The government is trying, but the government cannot do everything. We need to try, and this is where the Bates Foundation comes in to provide hope and healing. And we're just asking everybody to be a companion of hope. If you join us to be a companion of hope, you can help to ensure the sustainability of a population that has gone through 2 decades of civil war, the Ebola crisis, the COVID, just name it. They have gone through a lot, and they are persevering, but by themselves, they cannot do it. The Bates Foundation has come in, and we are there to provide hope and healing. We're just asking for companions of hope. That means we want you to please join us, collaborate with us, partner with us. And the way to do that is that you can go to thebasefoundation.org and see how you can be of help. Thebasefoundationorg.org is a way that you can go and find out how you can help.
Dr. Bates, thanks for your time. We appreciate it. I hope we can revisit this a few weeks from now. Let's reach out to those out there. We appreciate your time and effort, folks. Join us. We really need help in different areas. God bless you. And Dr. Bates, God bless you, brother.
Thank you, Reverend Moore. I appreciate the time and the platform to share these few things. I hopeful that will help those who are listening.
Okay. Bye bye.
Bye. Thank you.